Good morning, friends. This is a video demonstration of IAOS protocol for sinusitis, viral chest infections, severe colds, flu and other conditions. This is the 76th video of the advanced molecular therapeutic course, lesson 41. This video will demonstrate the procedures of intra-aural ozone administration with nasal inhalation of hydrogen for 20 minutes. A special oral insufflation stethoscope is needed. Normal stethoscopes may have plastic which will react with ozone and may not be suitable for intraoral ozone administration. The stethoscope should have stainless steel front parts with spring clip. The earbuds should be silicone. They must be a bivalve at the junction to allow one ear or the other. For example, if the patient has got one-sided temporal headache or one-sided sinusitis, we can put ozone in that ear alone to give him significant relief. In intra-aural ozone administration, the concentrations must be very high with the volumes very low. 1/32 of a liter or 1/16 of a liter is a normally acceptable flow rate, and we aim to get about 100 to 125 micrograms or more per ml in a minute. So, we need about 100 to 125 microgram of ozone in a minute with an oxygen flow not exceeding 1/16, else there will be a pressure build-up in the ears and this will cause severe discomfort. Before starting the oral administration, we must clearly tell the patient that he or she will hear a buzz noise or a humming sound during the entire process. This is due to the sparking in the ozone machine. For inhalation, we need to inhale 99.99% pure hydrogen at 600 to 900 or even 1200 ml per minute. Tiny machines of 150 and 300 ml per minute are not very useful and not very effective. They are meant for more prolonged inhalation overnight to be used by the patient at home. So, a big powerful machine is needed. This is a step-by-step video of the complete procedure done on my assistant as a demonstration. The intraoral stethoscope is first connected to the machine. There is a junction in between. In case the oxygen pressure is high, it will detach itself. The tip is attached to the ozone out of the ozone machine. Here we are using an IAOS Mark 9 ozone machine which gives 1/32 on 1/32 of a liter, it gives 125 micrograms of ozone. So, the regulator is positioned at 1/32 of a liter. We do not switch on the machine as yet. Keep the stethoscope ready. Now, the hydrogen inhalation tube is inspected and it is now attached to the hydrogen generator. The molecular hydrogen generator is now switched on from the back. It has a LED screen on the front and we can wait for the machine to warm up. Once the machine warms up, we connect the nasal tube to the machine. The machine with the touch screen is switched on, and the speed is kept at 900 milliliters per minute. This is a 1200 ml machine, but we are keeping it at 900 ml. We must see the two droplet LEDs in the bottom and wait for the bubbling to start to know that hydrogen has actually started bubbling. Once you see the bubbles in the lower half, you know that the hydrogen has started, and now we are all ready to begin the procedure. The patient is seated on the examination seat or a therapy chair. The ozone is now switched at switch 9, in this case where we desire 125 micrograms per ml concentration. The stethoscope is applied to the ear. The patient takes a comfortable seat and the hydrogen ports are inserted in the nose. The patient or subject in this case relaxes. The procedure is continued for 20 to 25 minutes in toto. We can adjust the chair to the comfort of the patient, and we can see that here we can start the procedure. I am sorry for the audio in the background. The procedure is continued for about 20 minutes. The chair can be adjusted to any position that we desire, and the patient inhales the hydrogen for 20 minutes as well as the ozone in the aural or the ear for the same time. This is not the actual procedure, but a demonstration on my assistant for educational purposes only. For further details, please contact me on WhatsApp on the above number. This is an ongoing and continuing lesson in the advanced molecular course, which is for exclusively the members of IAOS advanced molecular course participants. Thank you for participating. Have a nice day. Good day.